As educators, we will have students in our classrooms who have learning disabilities. It is imperative that we implement strategies that are effective in aiding in their comprehension skills. In a study by Dale Rose, 11 high school students with learning disabilities were interviewed on their perspectives on reading comprehension and what strategies worked for them. 3 themes were identified. The first theme is working instructional strategies. The students noted that securing their attention was the best strategy to enhance their reading comprehension. This could be done by asking an inattentive student a question, using proximity, and pausing to make sure students are attentive. Students explained that asking and answering questions, rereading, defining keywords, and breaking up or chunking longer passages also aided in their comprehension. The second theme was identified as thoughts on reading. Students described some feelings of discomfort and distractions in the classroom. When they experienced these negative feelings, it affected their comprehension. So the environment is important for educators to make safe, inviting, and comfortable. Students should also have text available that's on their reading level and on their interest level. That way they feel comfortable and confident when reading, which can increase word recognition and comprehension. The last theme students attributed to being helpful in their comprehension skills is their perspectives on teachers. Our own teaching methods and attitudes could positively or negatively impact these students with learning disabilities and their comprehension skills. So what else can educators do to aid in expanding comprehension skills in students with learning disabilities? Well, Rolanda O'Connor conducted a study to determine if increasing fluency rates for students with a reading disability would increase their reading comprehension. The study found that there is a positive correlation between fluency rate and comprehension, but there comes a point where the correlation breaks apart. When looking at the study's data, students in 2nd grade with a reading disability should be reading between 35 and 75 words correct per minute to improve their reading comprehension. And 4th graders, to improve their reading comprehension, should be reading between 40 to 90 words correct per minute. For educators working with students with a reading disability, it can be beneficial to work on fluency rate. When these students read at an appropriate rate, their minds can make connections with the text, forming a puzzle with puzzle pieces. So it is important to know when to stop focusing on and pushing fluency so as to not have a decrease in comprehension, negatively impacting students making connections as they read. Sometimes we have students with learning disabilities that are hyperlexic and cannot comprehend what they are reading. An implication from this study would be to work with and encourage these students to slow down their reading so that they can process the words and make the puzzle pieces connect. Noelle Chia and Norman Key performed a study specific to children with hyperlexia. This study was designed to test the effectiveness of the scaffolding interrogative method, or SIM, to teach reading comprehension to students with hyperlexia. They analyzed 10 students ages 9 to 10. The SIM technique incorporates the Picture Exchange Communication System, or PECS, as the comprehension strategy. Basically, the students learned to match what man's with its corresponding WH interrogative word. These would be what person for who, what action and what thing for what happened, what place for where, and what time or what day for when. Over 6 months, students would read sentences and place the PECS cards on the corresponding parts of the sentences to identify the WH interrogatives. When data was analyzed from the study, there was a significant increase in the students' reading comprehension, positively answering the question, is the SIM strategy effective for students with hyperlexia? This study was only conducted with a small sample of students with hyperlexia, so there's no guarantee that this technique would be effective with every student with hyperlexia or even students with other learning disabilities. But it does have one of the same implications as the previous study. Slowing the reader down to process different parts of sentences and passages can allow students to read deeper into the text, increasing their reading comprehension. The What Works Clearinghouse shows a review of 2 studies on dialogic reading. The studies previously discussed were tailored to upper elementary and secondary students. These studies on dialogic reading focus on improving communication and language skills with students with language delays ages 3 to 6. Dialogic reading is an interactive shared picture book reading practice that is intended to promote language and literacy skills in children. During the shared reading, the adults and child switch roles so that the child learns to become the main storyteller with guidance from the adult. The adult acts as an active listener and questioner. Adult participants were trained to do certain things during the shared readings: slow down to allow for responses, increase questions, expand on utterances, ask open-ended questions, praise and encourage the child, and follow their interests. Findings of dialogic reading show that the strategy can have a positive impact on children with language delays, communication, and language competencies, only with properly implemented training on the technique, meaning that the children only get out of it what the adults are willing to put into it. When working with students with learning disabilities, learning and implementing strategies may be time-consuming, but when an effective one is used and implemented properly, it can truly be beneficial to the student's learning.